Evidence-based medicine, medicine with a clinical acumen. Before 2000, investigations were less. For example, PET scan, advanced robotic surgeries, and many investigations were literally not available in India. So doctors depended on their skill, knowledge, and bedside experience. For example, we had a series of very great doctors like senior physician Jaswant Rao, like Dr. Balamba, still practicing, Dr. Y.K. Chari, Dr. Vasnarana, still there, Dr. Bansilal Vig, and many more. They used to provide a lot of bedside teaching when students are in the clinical rounds in different wards where they are posted. Mostly during internship, and some people used to do senior housemanship. These were the times people learned quite a bit apart from postgraduate students. Now, what is this new evidence-based medicine? To find out a kidney stone, we need a KUB X-ray after preparation of the bowel. But today, with the modern ultrasound techniques, we can easily detect the stone, and with modern equipment, under supervision, you can do surgery. There are a lot of advances. But you must listen to this example. One day I got MRI of my knee joint because it was available free. Then I showed to one my colleague, orthopedic surgeon. What he did, he saw the MRI. Then he said, who's this MRI is? Is he your relative? Because there are a lot of good packages in my hospital. Unfortunately, the doctor spoke to me about package. Then he said, your MRI shows no clean ligaments. ACL, anterior cruciate ligament, is not fully visible. Your meniscal injuries are obvious. Then I told, yes, there are a lot of injuries. And he said, he needs surgery immediately. Then what I did, I sat on my toes in a duck pose. Then I showed him jumping. Then he said, sir, what are you doing? I said, do you want to operate this knee joint? He said, no, you're jumping on your knees. I said, that MRI belongs to me. The doctor didn't examine the knee joint, didn't ask whose knee joint is, and he saw just MRI film, and the report came to conclusion that he needs surgery. Obviously, I was a motorcycle rallyist, climbed mountains, and rubbed my knee joint during army service, during martial arts, dancing. They have caused tremendous damages to my knee joints. MRIs always show no anterior cruciate ligament, no proper meniscus. So you see the evidence versus clinical examination. But my knee joint is perfectly fine. I can squat, I can jump. I'm still practicing martial arts. There is no pain, there is no swelling, but I have very strong thigh muscles, calf muscles, which keep my joints in space with a lot of synovial fluid. So what is the difference, my dear friends? Evidence-based medicine can mislead you unless you examine fully, completely, clinically. Today, a patient comes to a doctor with a knee pain. He says, go and get an MRI, go and get an X-ray. Arey Baba, at least see mobility of knee joint is there. Any crepitus? There are series of tests for knee joint to find out ACL injury, PCL injury, or meniscal injury. And do not forget to examine the muscles around the knee because they are the key players of knee joint function. But we want evidence-based medicine. Time has come to think, do we really give up all our clinical acumen? Only rely upon tests? I am sorry. No. I appeal to my close friends and colleague doctors. Do not give up our old teachings, what we are taught. And an MRI is a early gateway opening to operation theatre. It does help in finding out cancers, tumors, anatomically some anomalies, and after the trauma, great fractures, soft tissue injuries. There are so much of information you get with an MRI. But for a simple knee pain, for osteoarthritis, why you want to take an MRI of knee joint? Put your hand on the knee, that's enough. Serious investigation should be reserved at an end point. First, let us examine properly. Let us give due course of time for a person to understand what we are doing and to recover, and then do the investigation at the end. Actually, how this evidence-based medicine evolved? Because of the insurance companies, because of the employment claims. To give any bed rest nowadays, company wants an MRI of the patient. You will be surprised. I have taken 30 MRIs for a normal people without any medical problem. All the reports have shown some ACL is not visualized, some part of meniscus is not fine. So there are clinical deviations in our body with the aging, with the wear and tear, but they are not diseases. I will tell you simple anomaly of our practice. Any X-ray you report, you see cervical spondylosis. Is cervical spondylosis is a disease? I don't think so. It is an age-related biological degeneration of the spine. If you do wrong activities, wrong postures, do not maintain your muscles, and don't have general health, so your degeneration may begin early. Use of certain terminologies we can prevent. How can an 18-year-old boy you write a cervical spondylosis? Early cervical spondylotic changes. Absolutely not correct. 70 years man, X-ray report is given, early degenerative changes. How early degenerative changes? 70 years of wear and tear will have some problem in your bones, but they're all natural. But is the musculature around your knee joint fine? Is his mobility is good? Is the range of motion in the joint is fine? How much functionally he is active? These things matter for treating him. So that's how we have this lot of confusion. I get people from remote villages. Some person is bringing three MRIs taken in only 2 months. In 2 months' time, what changes your spine is going to have? Not much. Straightening of the spine, disc bulges, multi-level disc disease, or some amount of impingement, they happen over decades. They don't happen overnight unless there is a grave trauma or disease like tuberculosis in the bone. It is not right to take 3-4 MRIs and say that MRI was not okay, you take another MRI. We should not burden them by serious investigations. Yes, for a person from cancer who is recovering, we need to do several times PET scans and other scans to know the progress of the disease so that we can provide early and timely management. So these are my thoughts. So I don't know, many people may not like, but I find it medical sciences are slowly losing their application of clinical acumen and treating people with human touch.